I'm Jerry Davis from the University of Michigan. I'm going to be moderating this discussion today. Our panel today is called Evidence from Implementing Strategies for Aligning Research with Societal Needs. This is one of 3 panel sessions you'll be able to view at the AAAS session. And I'm delighted to introduce Vivian Tseng today. Vivian is the Senior Vice President for Programs at the William T. Grant Foundation, and she leads the foundation's grant-making programs and its initiatives to connect policy, research, and practice to improve child and youth outcomes. In 2009, she launched the foundation's initiative on the use of research evidence in policy and practice. That's generated over 50 funded studies that have informed the grant-making programs of private and public founders across the country. She's been instrumental in the growing field of research practice partnerships. Vivian, welcome.
Thank you so much, Jerry. It's a pleasure to join you on this adventure of hybrid conference presentations. I'm so pleased to be here today with you, even if in a virtual format, to talk a bit about our Institutional Challenge Grant Program. But let me backtrack a little bit before I do a deep dive into the grants program and give folks a sense of what the William T. Grant Foundation does. So we are a private foundation, and our mission is supporting research to improve the lives of young people. This has been more or less our evergreen mission for a very long time. But over the last few decades, we've been thinking hard about what it means to fulfill this mission. And really to support research that actually can improve the lives of young people, we've been thinking hard about what it takes for research to inform policy and practice. And this is the common challenge that a lot of folks talk about, which is that too often wonderful research is conducted, but it sits on the proverbial shelf. Or I think in today's world, it sits in the proverbial electronic database or on a website. But that's still very, very far from the action of policy deliberations or practice decision-making. And so we've been really trying to take this on of what can we do to better fulfill our mission so that research, the wonderful research that's conducted, can actually inform policy and practice and impact the lives of young people in this country. And so as part of that journey, as Jerry said, we started by funding research on research use. So, you know, as a scientific organization, it appears to us that, well, this problem of what does it take for research to inform policy and practice, that can be an area of scientific inquiry in its own right? It's an area where we can bring some good theoretical frameworks, do some good empirical analysis to understand what does it take for research to be useful and used. And so we funded a lot of research in that area, beginning in about 2009. As we got into that area, one of the things that was so promising were things that we've come to call research practice partnerships. And I'll be going into a little more detail about that. But research practice partnerships were just these collaborations where researchers and practitioners, and by practitioners, they can be agency leaders or managers. People have also extrapolated these into thinking about research policy partnerships. But in any case, these partnerships really emerged from these studies as really promising ways to improve the usefulness and the actual use of research evidence. So that got us really interested in understanding research practice partnerships. And that gets me to the last thing that I'll be talking about in my presentation today, which is our Institutional Challenge Grants Program. And one of the things I'll be talking about is, even as we recognize how promising research practice partnerships are, I would go out on talks at universities, and so many faculty would say to me, well, this sounds like wonderful work, but academia does not reward this kind of work. It's very hard to get this kind of work done. And so as I'll talk to you about, our Institutional Challenge Grant Program was then developed to address that part of the problem. So let me start by just talking about what it means to try to connect research and practice. And I'm going to focus here on practice, but we can think about it a lot in terms of research and policy too. I like to think that when I came into this field, I was very much like this man who was standing at the edge of the cliff, you know, doing wonderful research, being part of a wonderful research community, but thinking, my goodness, the work that I was doing as an academic and that we were supporting at the foundation just so often wasn't making it to the other side, to the policymaking side or the practitioner side. And instead, I'm looking down this cliff because I have a feeling where it really went is into this dark chasm of a hole. And just being really distraught by that. And I think many people probably relate to that experience. You know, it's not to say that people haven't been working on this as a problem. I think many folks have been trying to build bridges between research and the practice community. I think the challenge we had for many years is that too often folks thought about it as a one-way street, that we simply needed to get better at pushing out research, what we know from the research community, into the practice community, or some people would say into the policy community. It was very much a one-way street approach. And because so many academics conceptualized it as a one-way street problem, we would focus on the things that academics think matter. Well, we need to make our research more rigorous, because if we make it more rigorous, it's more valuable for use. And so there was a lot of activity on trying to make research more rigorous so that it was suitable for use in policy and practice. Another big trend was that the academic community and the research funder community thought a lot about dissemination. Okay, well, we have all this research that's not being used. We just need to be better at disseminating it, at pushing it out to different audiences. And I would say this dissemination approach, whether it was evidence-based programs or evidence-based practice, or whether it was a lot of the communications approaches. Oh, we just need to package the research better. We just have to be able to write it up in more, with more everyday language. We just have to present it more clearly. That these are still one-way street approaches. Another thing that we saw a lot of under this one-way street approach was the use of incentives. And we saw a lot of this coming out of the federal government, which was to say, especially in this area around evidence-based programs, this idea of we've got more and more evidence-based programs that are demonstrated effective in randomized controlled trials. If practitioners aren't adopting them, we simply need to create more incentives for them to adopt them. And there was a whole wide array of federal government initiatives that were based on this under sort of an evidence-based policy framework. I think where things have started to shift over the last decade is people thinking about this problem much more as a two-way street. It's not just about pushing research or what researchers know into practice or into policy, but it's really more about the back and forth exchange. And when we frame the problem in that way, what happened is folks became much more attuned to not just how rigorous the research is, but how relevant it was to the problems that practitioners face or the problems that policymakers face. So relevance really gained and sort of ascended in terms of how core it was in terms of thinking about research. It also, when we took a two-way street approach, started thinking less about dissemination and pushing research out, but more about back and forth engagement, folks coming together. And this really comes out of research on the use of research evidence, which shows that by and large, push out dissemination strategies have not been very effective in getting research actually taken up and used. But rather, it's much more the back and forth iterative engagement, because after all, research never speaks for itself. It always has to be interpreted. And when researchers and the would-be research users are actively engaged in co-interpreting that research, making sense of it for particular problems, particular issues, it's more likely to be used. And also thinking about capacity, that incentives are not nearly enough. If we think about the many public agencies and for us in education, child welfare, mental health, it's not enough to incentivize folks to use evidence. They have to have the capacity to really use it. And also researchers need to have the capacity to know how to do more relevant research, how to do more engaged research. And so thinking more in this two-way street approach about capacity. So those lessons really got us very interested in research practice partnerships as a set of strategies for making research more useful and used. And we define research practice partnerships as instances where folks have jointly defined a research agenda. So some people talk about this as co-production of research, but the idea is that researchers and practitioners come together and they co-define what is it that the problem that needs to be better understood and what's the research that needs to be conducted. For us, we like to think about research practice partnerships as long-term commitments, that a lot of the big, challenging, thorny problems we want to bring research to bear on will not be solved by one study or one project. Rather, when people work together on a long-term agenda over time, they can learn from the findings, which often lead to the next set of studies, and the findings can be implemented, and then they're learned from, and then there's an ongoing cycle. And that's how researchers and practitioners can really collaborate to solve some challenging issues. Of course, a lot of this relies on trusted relationships, and when there is a trust there, practitioners are more willing to trust the research. They're also more willing to deep dive into research on some of the really hard issues that they're grappling with. And for us, when we think about research practice partnerships, we're also very interested in institutional arrangements. So of course, there's interpersonal relationships that are so key to partnerships and the trust between them. But as we've thought about research practice partnerships and the fact that they need to be long-term and sustained in order to really effectively address complex problems, it's important that they be institutionalized and institutionally embedded so that there's supports on both sides of the partnership to sustain the work in an ongoing way. And so, we did a number of things at the foundation to support this burgeoning field of research practice partnerships in education and then in other youth serving areas. This is the website we developed of resources to kind of share out what we knew with the broader field. And it's really a curation job of what's already going on in the field and trying to create a one-stop shop for others in the field to learn from. But as I mentioned before, I would go out and talk to academics about them. And a lot of academics say, oh, I'm so interested in partnership work. I'm already engaged in some partnership work. But this is such hard work. And there are so many institutional barriers. And so what I would think is like a wonderful set of things to be engaged in which people really want to do. They find it as some of the most rewarding work that they do. It's incredibly hard to do. And some of those barriers are academic norms. The fact that academia traditionally has not valued research that has policy influence or social impact. Instead, what's most prized in academia is the impact of research on their fellow academics. So does it contribute to the scholarly literature is much more prized and receives much more attention than whether the research has some social impact in the broader world. And that is codified within tenure and promotion systems. So we see a heavy reliance on academic citation indexes as an indicator of impact of a scholar's work. But not, we don't have systems for thinking about how do you assess the social impact. And if we do have those good systems, they're not embedded within our tenure and promotion criteria and counted. So it's not incentivized and it's not rewarded. And even in places where it might be rewarded, too often the research is considered a service contribution and not a research contribution, even though it could be the research that actually had influence. And so thinking about what's being valued here in tenure promotion systems. And of course, training and professional development. A lot of the folks who do this work out there have had to kind of learn through experience, trial and error. There are very few formal, well-developed systems for training students or junior faculty to engage in this kind of work. I would say that we also see a lot of mid-career faculty, especially after they get tenure, who say, this is really the work I want to do for the rest of my career. But it's very hard for them to get the training and professional development that they need to do more policy relevant, more socially relevant research. And then another institutional barrier we see are simply academic silos. A lot of the challenging, complex issues that folks face, even in an area like education, are not easily solved by narrow disciplinary bodies of work. And that is what academics are trained and encouraged to do, is to really make their contribution in sort of on a narrow set of, relatively narrow set of questions over time. But when we look at the kinds of questions that even a school district or a child welfare agency wants answered, it's rare that those questions can be well answered by any one discipline. And sometimes by any one, even college within a university. And these academic silos really obstruct the ability to bring together different areas of academic expertise to really influence policy and practice. And so that's why we created an institutional challenge grant program. And I'll share with you what some of the change strategies are. So for example, and I want to share this with you because I think some of the barriers that I was showing here, these are not insurmountable. They are there. They are firmly embedded within our university systems, but they are not, they don't have to be sacred cows. Let me put it that way. These are things that we created, and we can also transform if we have the motivation and the will and the know-how to do it. And so I'd like just to think with you about some institutional change strategies that we are seeing from applicants to our grant program and some of the grantees. Some of them are directly taking on tenure and promotion criteria, so that the faculty who engage in research practice partnerships are rewarded and incentivized for it. It counts in their tenure and promotion systems. UC Berkeley is one of our grantees, and while they haven't changed tenure and promotion criteria, they've recently issued guidance university-wide to departments on how they can count community engaged research as scholarly contributions. So there's all sorts of things that universities can do to influence this so that this work is rewarded. Another strategy is to provide seed grants. You know, this is hard work to do, this relationship building of getting on the same page of what should the agenda be, not researchers coming up with their research agenda and then finding sites or samples with which to do the research, but actually co-constructing a research agenda. That's a lot of formative work. And so providing funding to help folks get started is another thing that some universities are doing. For example, at Cornell universities is trying some of that. Another way to support this kind of work is to provide teaching releases for the faculty who engage in research practice partnership work, recognizing that this work can be much more time intensive than traditional research, where a person has an idea and goes off and finds a place to study it, but really has to spend the time co-developing it and nurturing the relationships in an ongoing way. Some universities are creating faculty lines, so tenure track faculty lines that actually focus on research practice partnerships. So for example, at the University of California, Irvine, they created a position for a research practice partnership professorship. At University of Colorado, which is a grantee under this challenge grant program, they are experimenting with a tenure track line that focus on research practice partnership faculty. So not just a line, but they're experimenting with an entirely new track of tenured, it would be a tenure track line. And I think that's important because too often the folks who do this kind of work who are based in universities are not in the tenure track lines. And so it's relegated to the folks who are maybe adjuncts or work in research centers, but the sort of tenure lines are somehow insulated from this very important work that universities could be serving. And lastly, centers can be wonderful places that also provide a community for faculty and students to come together and learn about this. So for example, at Northwestern University, David Figlio, who's an economist and the dean of the education school, talks about it as an economist. He talks about it as reducing the costs for engaging in research practice partnerships work. So a center can basically provide the infrastructure that lowers the costs for faculty to engage in this work by making it easier for them to develop data sharing agreements, to develop relationships, to get the training that their students need or that they themselves need. So these are various institutional change strategies that can be implemented. And then finally, I'll just mention that some colleges and even at the university level are thinking about ways of incorporating research, practice partnerships, or community engaged research into their institutional or their college strategic plan. So really thinking about how to make it an integral part of how they see their work and mission. So I want to end by just talking about the different features of the grant program. So as I've mentioned, first, it's about establishing a sustained research practice partnership. Second, I haven't talked about this as much, but for us, it's about pursuing a joint research agenda to reduce inequality for youth. And that's another core area of interest to the foundation. Now, you notice we don't set particular aims, though. There's not a particular reform agenda we're after, because under this broad umbrella of a research agenda to reduce inequality for youth, it's really up to the practitioners, the nonprofits or the public agencies to co-develop the agenda. And then most importantly for this conversation today, it's about institutional change. It's about challenging universities to take a good look at their norms, their incentive systems in order to support research practice partnerships and the faculty who engage in them. And then lastly, I haven't spoken about this, but a fourth pillar of the grant program is to develop partners' capacity to do all of this work. And that's both the research partners' capacity to engage in this work, as well as the practitioners' capacity to engage in this work. And those are the two pieces I've talked most about today. And with that, I will just leave you with our website in case anyone is interested in more.
All right. Thank you so much, Vivian. That was so full of insights. The problem you're taking on is so important, and your diagnosis sounds exactly right to me. I see all of the barriers that you're talking about and you're trying to overcome. I wonder if you could provide some examples of what specific universities are doing, like who's really good at this and what are they doing?
Yeah, I mentioned a couple of them, but let me really highlight them. One is UC Berkeley. And, this is something that UC Berkeley did. It just came out of actually the application process, because I think we've seen in the application process, it's sometimes hard for universities to propose really bold ways that they're going to look at or try to change their institutional norms. And so a lot of times it's like, well, we'll have some conversations about it, and the reviewers for the grant program really pushed back on the UC Berkeley applicants, like, really, is university leadership really committed to this? I mean, is there really something behind it? And what that led up to was folks at the highest level of university leadership and in the faculty senate working together and ending up coming out with some guidance that they issued across the entire campus to say, look, there already are ways that you can count community engaged research as research contributions in the promotion and tenure process, but it's not being widely implemented. People don't know about it. And so as a first step, they drafted a set of guidance and issued it. And I think that's an important first step. And then other universities like Northwestern and Cornell are actually putting their own dollars into this to create, at Cornell, they're creating an associate dean line focused specifically on doing more of this community engaged research. They're providing seed grants. The dean is raising money, for the center and for the seed grants.
Oh, that's fantastic. It's great to hear that such elite institutions are really taking this on so vigorously. So speaking as someone outside the foundation world, could you say what makes some applicants or universities more successful than others in getting one of those institutional challenge grants you mentioned?
Yeah. So I do think one of the things I've observed is when there's true university leadership commitment, that can really make a difference. So often faculty already want to do this work, but they need leadership to really provide the infrastructure and support for them. And when universities have come in with deans sometimes as the leads, or at least as very important co-leads on the work, it strikes us as more likely to be successful. UC Berkeley actually came in with a collaboration between 3 deans, the Dean of the School of Education, the Dean of the School of Public Health, and the Dean of School of Social Work. And you can imagine the kinds of synergy that creates.
Thank you very much, Dr. Vivian Tseng. We've learned so much from you, and I appreciate this session very much. We have 2 additional sessions that are part of this broader panel coming up by Caroline Punov and David Hart. So please watch out for those. And thanks very much for joining us.